Check the accuracy and completeness of the medication administration record, MAR, with the practitioner's original order. Ensure the 6 rights of medication safety: right medication, right dose, right time, right route, right patient, and right documentation. Use a barcode system or compare the MAR to the patient's armband. Label all medications, medication containers, and other solutions, including those that are on a sterile field. The only exceptions are medications that are still in their original container or medications that are administered immediately by the person who prepared them. Place the medication reservoir into the PCA infusion device and prime the PCA pump tubing. Disinfect the needleless connector using vigorous mechanical scrubbing for a minimum of 5 to 60 seconds, according to the organization's practice with an appropriate disinfecting agent, for example, 70% isopropyl alcohol, an iodophore such as povidone iodine, or greater than 0.5% chlorhexidine in alcohol solution, and allow the solution to dry. If using a disinfecting port protector or cap, remove the protector or cap from the needleless connector. Discard the protector or cap in the appropriate receptacle. Ensure that both lines are flushed. Attach a primed IV fluid tube to the Y connector of the PCA pump tubing. Attach the PCA pump tubing to the access device. Program the computerized PCA pump with the prescribed medication doses, basal and on-demand, lockout interval, and maximal dose per the practitioner's orders. Have a second nurse verify that the pump is programmed correctly. Trace tubing or catheter from the patient to point of origin, 1, before connecting or reconnecting any device or infusion, 2, at any transition, for example, new setting, and 3, as part of the handoff process. Secure the tubing connections and anchor the PCA pump tubing to the patient in a secure location where it will not become dislodged. Label the tubing at the connection site closest to the patient and at the connection site closest to the source when there are different access sites or several bags. Do not force connections and avoid workarounds per the organization's practice. Check vital signs immediately after making any connection per the organization's practice. Administer the loading dose of analgesia as prescribed. Reassess the patient's pain status, allowing for sufficient onset of action per the medication, route, and the patient's condition. Assess for adverse effects of the medication, for example, respiratory depression. Have the patient demonstrate how to use the PCA system.